So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube session, we'll study about Spina Bifida, a very important topic. Four or five terminologies है basically जो आपको समझनी है and basically you just need to remember their images and उससे you can solve any type of question. So important question, एक question जनरली ये टर्मिनोलॉजीज में से इधर सर्जरी में पीडियाट्रिक सर्जरी में और ऑर्थो किसी का भी पार्ट मान लो इट कम्स ओके so sorry, this session will be very helpful for especially the FMG graduate. एक rapid revision type का session होगा उनके लिए who are undergoing the examination just next month, and also for the NEET PG 2022 where we will discuss spina bifida conceptually and अच्छे से कि yes actually what is this and what is important for your examination point of view. Okay, so currently I am working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. And before starting the session, I will just briefly guide you about a various subscription plans that are available on the Unacademy platform for the NEET PG. Okay. And the first one is your plus subscription. The plus subscribers will get access to all our live as well as recorded classes. They can access our entire QBank and they can compete in live tests and quizzes, all of which is found by the topmost faculty for the NEET PG in India, and also will allow the subscribers to log into multiple devices with the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, sorry, we are shortly providing them with the printed notes. So while subscribing you can use my code, that is Anshul B10, to get extra 10% off. The second one is your iconic subscription, and this is best subscription not only on the Unacademy platform but across any digital platform for the NEET PG in India. And what makes this subscription plan best is that apart from the things that I mentioned earlier, so all the benefits of the plus subscription will be available. In extra may you will get the prep ladder and all of the prep ladder including its entire QBank, the video lectures, rapid revision courses, grand test, etc. And on Unacademy extra me you will get well structured live batch wise classes, and we have formed our batches and structured our course in such a way so as to build your basic concepts about any subject or topic first, then going into its in-depth. And also after every test that you will give, the iconic subscribers will get an individual test assessment sheet so that they can analyze themselves कि yes this topic or this subject needs more revision, or what are the important things which are asked frequently and how the questions can be framed. So all these are very important for your preparation. And while subscribing for the iconic subscription you can use my code, that is Anshul B10, to get extra 10% off. Okay, special classes are very special because they'll give you extra edge over your competitors, plus they will give you a live classroom like feel where you can interact with your educators, solve your doubts there and there only, participate in polls, and you can watch it anywhere anytime on your mobile application. You have to just log into the Unacademy application using my code, that is Anshul B10. Okay, and both of which are absolutely free. And also for every special class that you attend you will be given the digital notes of that special class. We have launched a QBank. A QBank is very good because it contains every type of questions, and frankly speaking it contains questions which are meant for examination. Okay, the question will cover your entire theory. It contains the recent years or the recall previous year examination questions, the image based questions, CT, MRI, X-ray based, the recent advances, and very importantly the clinical scenarios and the clinical cases based questions all are included in a QBank. And also we have launched a new feature which is called as raise a hand feature, and we have launched this feature to make our sessions more interactive, to make this digital platform more interactive, and to increase the communication between the learners and the educators. So what you have to do, you have to just digitally tap on a button so that you can digitally raise your hand, and your educator will come to know about your doubt, and you can solve your doubts and queries there and there only. And also, for a very limited time period, that is only till 1st of December, we have launched a limited time period offer in which if you'll buy any subscription plan of 2 years, 4 months of that extra may you will get absolutely free. Similarly, for 1 year, that is 12 months, 2 months absolutely free. And for any subscription plan for 6 months, you will get 1 month of that extra may absolutely free. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off also. And these are the various subscription plans of a plus as well as the iconic subscription. And here you can see that the cost per month decreases significantly if you increase the duration of the or subscription course. So economically it is beneficial, and also it is very beneficial for academics also, that you should have a single source of information from the word go of your preparation, so that you don't have to hop around or study different subjects or different topics from different sources, because this will make your preparation and revision very difficult. So please do subscribe for longer duration wala course, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's session about spina bifida. Okay, so basically कि the vertebral bodies कैसे develop होती है, vertebral column कैसे develop होता है. The first of all, vertebral bodies develop, and these vertebral bodies develop from the mesoderm adjacent to the notochord. Okay, and from each vertebral body, suppose this is a primitive vertebral body, from each vertebral body the two processes निकलते हैं, and they later on fuse with each other posteriorly, and this entire thing is called as your vertebral arch. Okay, so this is your vertebral body. This pink color structure is your vertebral body, and from there two projections are present, and they too form the vertebral arch. This is your entire vertebral arch, and here the two projections fuse with each other. So this is your spinous process. Okay, these are your spinous. This is your spinous process, the most posterior wala part. Okay, and this entire part is your vertebral arch. Okay, so this is your neural tube, this is your notochord, and इसके आसपास के mesoderm से vertebral body is formed, from where the two projections are formed. So spina bifida is basically maldevelopment or a pathology in the fusion of these two projections. Okay, so the two halves of the arch fuse, and they fuse in the thoracic region, from where the fusion extends up and down. So if there is failure in the fusion of these two arches, it will lead to spina bifida. Okay, so spina bifida can be only of the musculoskeletal system without involving the spinal cord proper or the neural element, or they can also be associated with the maldevelopment of the spinal cord and the membranes. We all will see about it. So this is your spina bifida, which is an open defect, a true spina bifida. Yeah. This is your failure in the fusion of the vertebral arches, which will lead to the formation of the sac filled with meninges and the dura mater. The dura mater is and the CSF and the spinal cord proper. Okay, so based on the degree, it can be to the mere failure of the fusion of the spinous process, which is called as the bifid spinous process. Okay, and it is generally spina bifida occulta. And the other type, where there is formation of sac etc, proper spina bifida, so this is called as your spina bifida apercha. Okay, नाम से ही पता चल रहा है कि there will be no sac or outer external environment में. So it will be occulta, and if there is sag, it is aperture. Okay, so this is your normal spinal column, where you can see this is your vertebral body, this is your spinous process, and यहाँ पे this is your neural canal जिसमें there is spinal cord, and this is the last part, that is the cauda equina part. Okay, now in spina bifida occulta, what happens, there is bifid spinous process, means the only the spinous process के level पे fusion of the arches will not take place, so there will not be any sag etc, means defect will not be open like this. So this is your spina bifida occulta, and spina bifida aperta can be of two types basically, meningocele or meningomyelocele. Okay, so meningocele नाम से पता चला there will be only meninges, क्योंकि mylomeningocele के अंदर myelo means spinal cord. Okay, so here you can see there is a sac, there are will be only meninges plus CSF, whereas in myelomeningocele you will have the meninges, CSF, as well as the spinal cord proper. This is your myelomeningocele. So most common and least serious और सबसे बेस्ट प्रोग्नोसिस वाला is your spina bifida occulta, and mostly it is a accidental finding on the x-ray etc, and there is no treatment required, and generally there are no signs and symptoms also. Okay, people are not even aware about it. Okay, that's why it is an accidental finding. The next mm, most common and उससे थोड़ा ज़्यादा serious is your meningocele, and the most serious बिल्कुल worst prognosis वाला is your myelomeningocele. Either the child is stillborn or the child lives mostly only a few days because there of the infection of this spinal cord in the sac. Okay, so it is the most serious type, that is myelomeningocele. So spina bifida occulta, as we have read, mildest and the commonest होता है due to failure of the vertebral arches and fusion of the vertebral arches के failure की वजह से, and there is bifid spinous process. Okay, commonest it is in the LS spine, lumbosacral spine, उसमें भी S1 is the most common area where you will see spina bifida occulta. Okay, generally the skin is normal, there can be only a very mild swelling, but there can be characteristic yani telltale signs of the spina bifida, like the lipomatous mass can be there, there can be a sinus, dermal sinus, or there can be a tuft of hair. All these can be present, or just a dimple in the skin can also be present in case of spina bifida occulta. Now it is, next point is very important, that the amount of the bone defect or the severity of the bone defect is not proportionate or related to the neurological impairment. Okay, ऐसा नहीं है कि अगर बोन डिफेक्ट ज़्यादा है तो न्यूरोलॉजिकल इम्पेयरमेंट भी ज़्यादा होगा. सो वेरी इंपॉर्टेंट, एंड द मोस्ट कॉमन neurological involvement is paralysis of the muscle leading to the imbalance of the lower limb. Okay, lower limbs are involved. Okay, obviously most commonly lower limbs will be involved, and paralysis and imbalance of the lower limbs. So most common foot के अंदर deformity is your equinovarus, and in hip के अंदर most common deformity is that of the adduction deformity. Okay, equinovarus most common, followed second by the cavus. Okay, and in hip there is adduction deformity. Now what happens, the neurological impairment can be due to there can be tethering, or there can be attachment of the spinal cord with the undersurface of the skin. Okay, and there will be a fibrous membrane joining these two, and this fibrous membrane is called as the membrana reunions, or there can be this tethering with the phylum terminal last part, or there can be diastometomyelia. Now very importantly, what is diastometomyelia? Diastometomyelia is nothing but The spinal cord bifurcates because there is a bony septum in the neural canal. Okay, so there is a bifid cord and transfixed with an anterior posterior bony bar. Okay, now you will understand. See, there is this bony septum in the neural canal. That's why the in this area the spinal cord will be bifid. Here you can see this is bifid spinal cord, and there is this bony septum in the neural canal. Bony septum and bifid spinal cord. Okay, and this is your bony septum. This is diastomatomylia. Okay, bifid cord and a AP bony septum. And also there can be neural maldevelopment, which is called as myelodysplasia. So myelodysplasia is basically a group of symptoms. ओके एंड माइलोडिस्प्लेजिया में स्पाइना बाइफिडा ओकल्टा भी आता है, लाइपोमेनिंजियोसील, मेनिंजियोसील एंड माइलोमेनिंजियोसील, विच इज in the sense true spina bifida. Okay, true spina bifida. Okay, so don't get confused कि spina bifida है तो फोटो ऐसी है, but that is myelomeninger, ये उसी का ही टाइप है. And myelodysplasia is the generalized term, but इसकी खास बात ये है there should be neural involvement. Okay, there should be neural involvement and neurological signs. So then it can be called as your myelodysplasia. Okay, now we have seen about the this is your diastomatomyelocele. Okay, diastomatomyelocele or diastomatomylia. Okay, see, this is a spinal cord defect. Okay, it is of two types. इतना deep में नहीं जाना है. This is a segmental anomaly. Okay, we all know that. Here you can see very easily. इतना deep में don't need to go. And here also you can see this is diastomatomylia. Now what is diplomylia? Diplomylia नाम से पता चल रहा है two spinal cord. ठीक है, and in diastomatomylia the spinal cord was बाइफरकेटेड, यानी एक सिंगल स्पाइनल कॉर्ड थी, वो बीच में कुछ देर के लिए इट इज बाइफरकेटिंग. ओके, और बाइफिड. whereas in diplomylia starting से ही there are two individual spinal cord. okay, it is duplicated. So very importantly ध्यान से read the answer कि diastomatomylia है या diplomylia है. okay, now treatment, as we have already told कि if generally in case of occulta it is symptomless patient, accidental detection on the x-ray, so no treatment is required. And if there is only a mild backache type of problem, physiotherapy and NSAIDs. And if there are neurologically deficits, okay, then first is the diagnosis. Okay, they have to be evaluated अच्छे से, MRI and etc. And so the investigation of choice is MRI. And then they have to evaluate it the कि किस type का, or if there are any other congenital defects present or associated with this. So orthopedic point of view से the treatment is basically for the three things: to the prevention, and if there is any correction of the deformity like the equinovarus or the hip adduction etc., and the power is less, so to regain the residual muscle power, proper physiotherapy or tendon transfer or joint stabilization. And third is your to give walking, so to give support for the walking or maintenance of the posture. Okay, so spina bifida occulta we have read completely. Now we will come to the spina bifida aperta, जिसमें other than the vertebral arches there is a defect in the underlying soft tissue, skin and meninges etc., and it can be in the nerve tube also, the defect. Okay, so the most common site occulta की most common site was lumbosacral spine, whereas spina bifida aperta most common site is your dorsolumbar spine or the thoracolumbar spine. So meningocele we have already seen ki there will be meninges and CSF. Okay, not the spinal cord, whereas in meningomyelocele there will be meninges with neural elements like spinal cord or its last part, cauda equina, etc. Okay, now there are certain terms that you should know, that is syringomyelocele. Okay, so syringo आते ही spinal cord, myelo means nerve or neural element, it that is myelo. Syringo means spinal cord proper, and cele means sac or cavity. So this is protrusion of the spinal cord. Okay, this was protrusion of the meninges along with some neural element. Okay, so here the spinal cord is developed normally, whereas if the spinal cord proper comes out through a defect with CSF and meninges, etc. Okay, and this defect is continuous with this neural canal, this is your syringomyelocele. Okay, here you can see this is your syringomyelocele. ये तो है myelomenincocele जिसमें you have the spinal cord or the nerve tube, nerve element, but this spinal cord पूरी ही आ रही है, there is no connection with the central canal. But here the spinal cord is bifurcated like this, and there is the sac is in connection with the central canal like this. This is myelomeningocele. Okay, and what is syringomyelia? Syringomyelia नाम से पता चल रहा है there is no sac. अगर sac होगा तो seal आएगी, means syring यानी there is a protruded meningeal sac inside the syringe, that is the spinal cord, like this. Okay, this is blackish, black is your spinal cord, and a spinal cord के अंदर there is a fluid filled sac. This is called as syringomyelia. So the cord lies within the protruded meningeal sac together with the nerves arising from it. Okay, so there is a fluid filled sac that is sitting within your spinal cord. Okay, and as it enlarges, obviously it will damage your spinal cord, pain, weakness, stiffness, etc., and the prognosis is poor. Okay, and the prognosis is poor. Now myelocele में क्या होगा, sac with the nerve elements. Okay, so this is due to arrest in the development at the time of just closure of the neural groove. This is your myelocele. Okay, so spina bifida occulta के अलावा जो different types के we have seen the spina bifida, they all are basically mostly stillborn, and if they are alive they die within few days due to infection, as we have already seen. Okay, paralysis of the lower bone होगा, hip में flexion adduction deformity, foot के अंदर equinovarus we have seen. Okay, and there may be urinary and bowel incontinence also. Okay, so treatment, first of all basic defect spina bifida का treatment, orthopedic treatment that we have discussed already, and the urological treatment or the surgical treatment for the bladder or bowel incontinence. Okay, now meningomyelocele we have already discussed everything about it. Okay, and if any of these defects communicate with the central canal of the spinal cord, then prefect syringo is added. So syringo means if central canal of the spinal cord is also affected, means syringocele, syring is attached like syringomyelocele. Okay, into the spinal cord there is the accumulation of the CSF. Okay, into the spinal cord there is accumulation of the CSF. Okay, so here you can see that this is your spinal cord, central canal intact, and there is CSF with meninges. So this is your meningocele, meninges plus CSF. Okay, here also central canal is clear. Okay, central canal is clear, there is no association. So here there is meninges, CSF, meninges plus CSF plus spinal cord, okay, or the neural element. So this is your meningomyelocele or the myelomeningocele. Now in third you can see ki there is spinal cord, CSF, meninges, but there is communication with the central canal. Okay, so this central canal के साथ communication है, so it is called as syringo mylomeningocele or syringomyelocele or myelocystocele or myelocystocele. And here you can see this is a myelocele where the neural groove pe there is failure of the fusion. So here you can see CSF etc, just your myelocele, that is only the spinal cord is in the sac. Okay, so this is your myelocele, meningocele, meningomyelocele, syringomyelocele, and myelocele. And we have discussed the syringomyelia. Syringomyelia क्या होता है? सेंट्रल कैनाल ऑफ द स्पाइनल कॉर्ड जिसके अंदर देयर इज फ्लूइड फिल्ड सैक, डायस्टोमेटोमाइलिया एंड डिप्लोमाइलिया. ओके, वी हैव सीन. सो ऐसी टर्मिनोलॉजीज है, एक पेपर पे यू राइट देम और जस्ट सेव द इमेज और टेक द स्क्रीनशॉट ऑफ ऑल ऑफ दीज टर्मिनोलॉजीज एंड सी द फोटोग्राफ. हर 10-15 डेज में 5-10 फोटोग्राफ देखने के लिए यू नॉट इवन रिक्वायर 5 minutes, and it is the best way to remember and to revise. Okay, so please do this. Okay, very easy thing and very scoring thing. So this was a short lecture on the spina bifida. Thanks for watching my video. If you like my video, please like, share and subscribe, and also see the other videos on the YouTube and the special class. Okay, and you can use my code while subscribing for any of the subscription plans on the Unacademy, and you will get extra 10% off. Okay, so study hard, take